Hi, it's Mason, the editor of HR Exchange Network, doing another live interview here at the CHRO Exchange. With me, FinHealth founder and CEO, Jim Arnold. Jim, thank you for being with us.
Hey, good afternoon. How are you?
I'm doing very well. So this is our second live interview of the day. We're going to talk about some healthcare issues, and Jim has a lot of great knowledge about that. So let's just start off with the first question. It's a broad question. Consumers and companies spend a lot of money on healthcare. Right. So can you broadly discuss how that money is spent?
Absolutely. And it's going to be a little bit different depending upon the company and their demographics. But overall, about 30% of it goes to hospital. So those are hospital-related things, room and board, operating rooms, things like that. Probably about 25% are physician encounters. So whether they're an annual visit or whether they're a consult with a radiologist for an orthopedic, that's about 25%. About 15% is surgeries. And then the balance is really, radiology, drugs, infusions, non-physician medical services.
Okay. Can you list, and this was something that I found interesting on your website, can you list the 5 questions companies should ask about healthcare expenditures and kind of explain those a little bit?
Sure. So I would say the first one is really what metrics are you using to measure healthcare? How do you know your process is successful from an accuracy standpoint, from a quality of the providers you're using, from a timeliness, and ultimately from a patient satisfaction? Are your employees, who are ultimately your patients and customers, are they happy with the service? So that's the first one, is really around metrics. Second one is really, are you holding your third party accountable? So you've essentially taken your healthcare checkbook and you've handed it to somebody else and say, please pay these accurately, only for eligible employees, dependents, and spouses. Try not to make any mistakes. But the reality is, even if you do, you have access to my bank account and you're going to take that money out at the end of the week. So some of the other things we look at are, what are the best practices out there? What are the Boeings of the world doing? What is the Mayo Clinic doing? What is Walmart doing? What is GE doing? So we think that's really important. Another one really evolves around the wellness aspect. So what about health assessments and what about fitness trackers? How do they fit into your overall health profile? Because when you're a company, it's sort of a population health issue, and you have different data sources, and the claims themselves is just the history. Here's what happened in the past with Mason, but what is his profile today from his assessment? What is his ongoing heart rate, sleep metrics, and things like that? So those are some of the key ones that we see out there.
Okay. Third question, of the money spent, how much of it can be tracked back to spending errors?
Okay. So probably the most authoritative source that we've seen on that is really the federal government. So the federal government audits about 50 to 100,000 claims a year, and they find a net error rate in the 12 to 13% rate. Now, interestingly, not all of those can be found without actually tracing back to the medical records. So probably maybe 2/3 of them you can find them. Those are different types of coverage errors or duplicate payments or maybe age or gender conflicts or just medical codes that are not allowed to be billed together, either because they're upcoding to a higher level of service or they're just incompatible. So you can't have a live birth and a cesarean section. There's certain surgeries that overlap, or one's a component of another, so there's a lot of guidelines to say you can't bill these two together. So if you're doing an endoscopy of the shoulder where you're shaving the bone, and you're doing an endoscopy of the shoulder where you remove tissue, you can't charge that as 2 full surgeries, because at the end of the day, there's one incision, one anesthesia, and there's massive overlap. So, and these were all designed by Medicare administration in conjunction with the AMA. And there's other ones that are quantity, so what's called medically unlikely edits. You can't bill me more than a certain number of units, usually because it's either dangerous, but more than likely it's probably a mistake.
So HR professionals out there, probably, hearing you talk about that, one of the questions they probably have is, what is the most common types of spending errors?
Right. Okay, all right. Well, one of them, probably a basic one, is a coverage issue. So employees with your company, then they leave. So they still have the medical information on file, but they go to company B, they go to work for them, but the bill is submitted under the old insurance. And unless the proper controls are in place, that will be paid. So it might be paid 30 days after the fact, 60 days, and it also depends on your cycle with your third-party administrator as to how frequently you send that data over to them. So we think of that as coverage or eligibility. There's other type of eligibility issues. things like, are the dependents really dependents? Is the spouse still a spouse? So some companies will do, different types of eligibility, whether request marriage certificates or tax returns or other things, birth certificates. But they're only done periodically, and sometimes you can find it within the data. So if you have the data and you can see that the employee and the spouse are living at a different address, well, guess what? I think they're divorced. Or I have a particular employee that has 19 dependents. You might want to take a look at that. Or the dependents are located in different states with different last names. Well, it's not unusual for someone to put their nephew or their niece on a policy. I was talking to a gentleman today, and he said they had done an eligibility audit. Took about 5,000 people off their plan, which is substantial.
Yeah, that has to be. So once spotted, how can those errors be corrected?
Right. Some of them are easy. So ideally, you want to work with your TPA, your third-party administrator, and that could be Aetna, could be Cigna, Blue Cross, United Healthcare, and you want to flag them as close to the transaction as possible. Mm-hmm. Because the longer you wait, number one, the less likely you'll get the money back, and number two, it's more painful for the third-party administrator and the provider who received those monies in error. So what we want to do is the day it happens, okay, this is a duplicate payment, or this is somebody who's no longer covered, or this is a medical coding where you're not allowed to bill it. Now with some of the TPAs, we hope to get it before the money goes out of their account, but in some cases, they pay it out and then we have to get a credit back. So, but it's all handled. They have regular relationships with those providers.
Gotcha. So what other types of data can FinHealth gather and analyze for clients?
Ideally, we start off with the historical data, and that's where most of the costs. So healthcare costs are the second largest people cost after salary, and probably upwards of $13,000 per employee. And so we would just get those records through your third-party administrator. We've only found that about 10% of the companies we've worked with actually have the data in-house. Now that's actually a problem because the company, regardless of who you're using as a third-party administrator, they are not the fiduciary. You're the fiduciary. And ultimately, you can't really exercise your fiduciary responsibility without ever receiving the data. How do you make sure you're in compliance with all those things? So we would say request it from the third-party administrator and request it as close to the transaction as possible. So even if you don't use somebody like that, us, you still want access to it because ultimately you need to make sure your plan is in compliance.
Okay. Question 7. For companies, can you tell me what some of the best practices might be to minimize errors and how to better ensure a control on spending?
Right. Well, definitely first, check with your third-party administrator and say, what are you doing? Document the procedures. Some folks are really digging in sort of from a Sarbanes-Oxley to say, okay, well, ultimately it's my checkbook, right? And even though I'm using a third party, I need to sign off that all the key financial controls are in place. So that's certainly one. We believe education is probably the biggest component because there are not just black and white errors. There's that MRI that should only cost $500, but guess what? You just paid $5,000 for it. Mm-hmm. Right. We had a gentleman who talked to us today, and he had a bill for, I think it was in the neighborhood of $28,000, and he didn't think it was justified. He went and took it to the provider. They gave him a $26,000 discount off his $28,000 bill because they had overcharged him. So just the employee awareness, and we believe that there's certainly education of the employer, get more involved, get the data, understand the data, but also have the employee get more involved. So you're going to be a better consumer if you just paid $2,000 for something and you realize that it really only should have been $500. And oh, by the way, your provider was a 2-star on a rating of 1 to 5. You're going to be a little more concerned and you're going to raise questions. And ultimately, that's what needs to happen because there'll be things on the bill, and if you don't ask the questions, you're just going to end up paying them, or your company's going to end up paying them.
Companies want employees to be better consumers. How can companies be better consumers when trying to control healthcare costs?
I think there's a lot of great solutions out there. Some of them are prepayment. So I think Leapfrog and what's one of the other? Castlight is one of the very popular ones. And certainly there's a lot of information there. U.S. News and World Reports, Consumer Reports. We've found some Medicare sites, some surgeon ratings. So the more you understand about the doctor you're going to use and what their cost structure before you make a selection, the better off. But the challenge is you're going through a rough time and you have this medical thing, you're very worried about it. It's really hard to focus on cost and quality at that time.
Right. I think this is a big question both for customers and for HR professionals. How important is the education part of this? Because there's a lot of information out there, and it's important for folks to understand the realities here.
Right. And one of the key parts of what we do is really to educate them. So not every article on healthcare is of value. So if I'm in my total rewards role and a lot of things have to do with Medicare, well, that doesn't impact me. It's really the corporate thing. So what are those things happening in the marketplace? What's happening to Aetna, Blue Cross? What are the best companies out there doing? So somebody like Boeing is doing some direct contracting. Is that a fit for my company? It might be if I'm in certain geographic areas where I have enough power to really do that. Or centers of excellence. So the concept of a center of excellence is that I can either use my local provider or I can go to the best provider in the country. So we had a speech today by I think it was Kathy from Mayo Clinic. So they're definitely considered one of the leading edge thinkers. Cleveland Clinic is another one. And so some of the large companies will send somebody to a centers of excellence. And their choice is you can go to the local provider or you can go to the center of excellence, in which case there'll be no copay, no deductible, no coinsurance. We will fly you and a caregiver to this best place and they'll take care of you. And what we find is, obviously they're getting the best care. They're not going to be out of work as long. They're going to be very happy. But the most amazing thing is probably about 25% of the time, they will reverse out the local diagnosis. So my doctor, who's only seen 3 of these cases in the last year, thinks it's this. Well, Mayo Clinic treated 400 of them last week. They just know it much better. They know what's available. They know all the latest developments in medicine. And so they'll be able to take better care of you there. So we see that growing. And it also helps because many companies feel locked in that they only have 2 hospitals in their geography. But if you can sort of change the dynamics of that, so competition isn't just the one in your local city, but might be one of these places that are further away, particularly if it's discretionary or something that can be done, on your own timing.
Okay. So we'll make this the last question. How do you compile the information about hospitals and procedures, specifically rating and operation costs? Because that's
right. Great question. We find there's a lot of big data out there, so there's a lot of sources. So far, the most reliable one we've seen for hospitals comes from Medicare. So Medicare is CMS, the Center for Medicare and Medicaid Services. They put out reports on all hospitals. Every hospital has a rating of 1 to 5 stars. Only 7% get that 5-star rating. And it's based on some sub-criteria regarding safety, patient satisfaction, readmissions for the same cause, hospital-borne infections. So they do a very deep dive, and the hospitals are required to report back on all this information. So for hospitals, that's by far the best one. There's also some really good ones on U.S. News and World Reports. If you have a very complicated surgery, that might be the place to go to find it. Consumer Reports has some. On the provider side, it's a little more difficult, but we have found a site called surgeonratings.org, which is excellent. And so we've used that on a number of occasions to say, well, gee, this is based on outcomes that particular physician has generated. And of course, not everyone is willing to participate, but those that do, you get a real comfort level that this person has experienced, they have good outcomes, and ultimately that's going to be a better answer for you than somebody who just does this once a year.
Right. Well, that's the last question I have. I really appreciate you taking time. I know you've got a lot going on. I've seen you up and down the hallway. It's like a marathon in itself.
Right.
So I certainly appreciate you taking your time to sit down and answer some of these questions. And, regardless of what's happening politically speaking, healthcare is a big deal, and people need to have as much knowledge about it as possible going down the road.
Absolutely. Better knowledge, better decisions, but better outcomes for folks.
All right, very good.
All right.
Thank you very much, Jim.
All right, thank you.